Hello everyone. Nung ako'y naging first-time mom, personally wala akong experience ng allergies or eczema or any flare-ups. Pero when I gave birth to my firstborn at kumain ako ng bagoong in Pangasinan, I saw what I thought was a manifestation of flare-ups. Bigla nagkaroon ng red spots yung anak ko and everyone around me was saying, sandali, kumain ka ng shrimp or crab or bagoong? And I said, yeah. And they're like, oh no, lumabas yan sa milk mo. And then your son now is reacting to it. So it gave me a scare and it made me realize na ano pa ang pwedeng triggers. And while he was growing up, he had manifestations of eczema. Sa crook of his arm, sa batok niya, sa leeg, sa likod ng tuhod. And it's been really bothering him. Not too much na nagdudugo, which is, quite a relief for me. Pero marami akong kaibigan who are experiencing the absolute worst na talagang, it's like a living nightmare. They're trying to soothe their child, trying to put them to sleep. They themselves couldn't sleep because of worry. And so as a community, we have so many questions about flare-ups, skin flare-ups, especially with eczema. So today on our episode of Insights, meron tayong special guest, Dr. Perla Lansang. Specialist siya pagdating sa Pediatric and Adolescent Dermatology. Dr. Lansang, welcome to the show.
Thank you for having me.
And so yung experience ko na una, tama ba yung hula ko? Eczema ba yun? Kasi feeling ko parang simultaneously nangyari. May kinain ako na talagang in-enjoy ko, bagoong from Pangasinan, the best. And then, when I fed my child, shortly after, meron nga mga lumalabas na spots.
Alam mo, that's a very common misconception about eczema, that it's always triggered by food or there's always a trigger for eczema. Pero malamang nagkataon lang yun. Eczema is quite common. Some reports say 1 in 5 children can have it. So talagang hindi naman siya rare. So minsan dahil nangyari, tas may nagawa ka, nare-relate mo kahit hindi naman masyadong related talaga.
And I think it's also because a lot of people nickname it as skin asthma.
Yes.
Na pag hinika ka, kasi may nangyayari in your environment, in your body. So iniisip natin na baka same goes with our skin, na if we eat something or it's, pinawisan ka, may triggers ba talaga ang eczema?
Well, meron talaga siyang triggers, no? Like you mentioned, pag pinawisan ka, pag masyadong malamig, pag very dry, yung ibang tao, if they wear something scratchy like wool, or dito pag naka-scarf ka, di ba sa winter, makate. Some kids, when they roll around in grass, magkakaroon sila ng eczema. And then, of course, there are some kids talaga na allergic talaga sila sa pagkain. Pero yung allergy sa pagkain, hiwala yun dun sa eczema. And yes, of course, if you have allergies to food, that can trigger the eczema, pero hindi yun yung cause. So iba yung association, iba rin yung cause. Kasi parang ang cause, ibig sabihin, pag tinanggal mo yung food, mawawala yung eczema, which is not necessarily true.
Backpedal tayo ng konti. So when we say eczema, ano exactly yung description niya? Kasi baka isipin na iba, ano yung rashes? Ano ba yun? Thickening of the skin lang. So yung talagang pinaka-itsura na manifestation, could you please explain that to us?
So yung eczema, usually, ang hallmark ng eczema, it's really itchy. So makati siya. Pag hindi makati, it's unlikely to be eczema because eczema is almost always itchy. So yun yung una, kailangan makati siya. Usually mapula or pink. Pag matagal na, pwede siya maging brown or darker, pero usually mapula siya sa una, lalo na when it's flaring. And then as you mentioned, merong mga areas of predilection. So may mga areas na mas madala siya. Usually, pag older child na, toddler or mas matanda, yun nga, yung dito sa crook ng arm, sa likod ng knees, sa leeg, very common, sa face, minsan sa hands din, because when we wash our hands all the time, that can trigger eczema as well. Although in babies, very common yung eczema sa face, tsaka sa head, sometimes even in the diaper area, magkakaroon ng eczema. So pwede siyang in many places, but really the hallmark is rash siya. So it's scaly a little bit, tapos makati siya.
So if we do see some manifestations, let's say dun sa may puwet area ng baby, of course we have our diaper creams. Would that take care of it or hiwalay yan?
Hiwalay yan usually. So yung diaper rash, iba din yun sa eczema kasi usually yung diaper rash is because yung moist yung area ng diaper, tapos parang nagbe-break down yung skin in that area. So that's a little different. Of course, there's many things in the skin that are also itchy and red and scaly. So it's really best to see your doctor para ma-diagnose ng mabuti. Kasi syempre, you don't want to miss anything else. Madami rin naman ibang conditions that can look like eczema but are not eczema.
Most of the mom and dads that I speak with, unang-una lang ginagawa, takbo sa kanilang grocery store / pharmacy, manghuhula na yan kung anong creams, kung anong baby soap. Kumbaga hinahanap nila kung saan hiyang yung skin ng anak nila. Yeah. And then some are lucky enough na medyo humuhupa, right? Meron namang iba, lalong lumalala. Yeah. So, andun ba yung factor na kailangan walang perfume? Ano yung mga kailangan mong hanapin sa skincare line ng ating young children?
So I often tell my patients, when you're taking care of kids who have eczema, 50% is skincare and 50% is getting rid of yung inflammation na sinasabi natin. So let's talk about that skincare first. So very, very important yung skincare kasi kids who have eczema, usually yung skin nila is not 100% normal. Madali mag-dry, madali ma-irritate, mabilis siya kumate. So those things. So things that are important are, one, try to avoid harsh soaps. So yung mga bar soap, minsan nakaka-dry yan ng skin, lalo na dito sa Canada, ang lamig. Di ba pag winter, kahit wala kang eczema, minsan matutuyo yung balat mo. And dry skin on its own is already itchy. So you want to avoid very harsh soaps. And then moisturizing is very, very important. So after bathing or after a shower, it's important to moisturize, sometimes even 2-3 times a day. Syempre, we want to avoid too much fragrance. It's not necessarily that fragrances are bad, pero when you have eczema, madali nga ma-irritate yung skin. So things like very harsh fragrances or even medications or creams with a lot of preservatives that can irritate eczema-prone skin, and you can actually develop allergies to fragrances in the future. So it's always better, the less ingredients, the better. And also, the other thing I want to point out is natural doesn't necessarily mean better.
Oo, kasi yun yung selling point ng most skincare lines, no extra whatnot na hindi mo ma-pronounce. And syempre, the less, complicated the wordings are, mas mahal kasi sinasabi nila na ito organic, lahat-lahat, and may kita mo lang sa Whole Foods. So not necessarily yun ang best option for treating somebody with eczema.
Yes. So all natural doesn't necessarily mean one hypoallergenic. It doesn't necessarily mean na hindi magre-react yung skin. Because there are some things that are all natural, like lanolin, let's say, is an ingredient that's very common in moisturizers. Maraming tao nagiging allergic sa lanolin. And I often tell my patients, well, poison ivy is natural. It's one of the most allergenic things. So there is some truth na parang hiyang malalaman mo kung if there are some things that you're actually allergic to, you should avoid them. Pero to start with, I think something simple, straightforward, no fragrances, as simple as possible. It doesn't have to have like plant extracts, yung mga ganyan. Madaming ganyan, di ba? They add, extract of this and extra vitamin E and shea butter and tea tree oil. You don't really need all of that. I think something that's a gentle cleanser and a gentle moisturizer. I mean, even petroleum jelly is great, lalo na pag baby kasi, madulas, greasy yung petroleum jelly. And older kids tend to not like it, but as babies, it's very safe. There's no preservatives. There's really no fragrances in petroleum jelly. So if you have a kid a baby who has very dry skin, that's a good place to start.
So talaga ang number one priority is to moisturize.
Yes.
So yun nga lang, ang medyo agawan is which brand, which skincare line, which is curious because generation ko and maybe older, lumaki tayo, meron na ngang lotion, meron pang pulbo, meron pang baby cologne.
Oo. Yes.
So ngayon, inaaway natin yung mga parents natin na, huwag mo lagyan ng pulbo yung anak ko.
Yes.
Of course, the lola will be like, kailangan mabango si baby.
Yes.
Hala.
Yeah,
so is that actually harmful?
I mean, like cologne, if you think about it, cologne is usually alcohol-based, so very drying siya. Tapos, if your baby or your child has eczema and you're putting something like cologne, mahapdi siya sa skin. So, mabango naman yung baby naturally. Hayaan na lang natin silang ganon, di ba? So I think you're right. Like the simpler the skincare regimen, the better. Really moisturizing. If you're moisturizing well, that's really all you need. Minsan nga, I tell moms, especially if the babies are very young, you don't even need soap. Kasi hindi pa naman sila
Madumi.
pinapawisan, it's different than like a 7-year-old boy na takbo ng takbo. So for babies, sometimes you don't even need soap because that can strip away the moisture, the natural moisture of the skin.
That's actually my next question. I wanted to debunk some myths. Kasi tayo, especially coming from a tropical country, 2 beses tayo maligo. Pawis na sa umaga, pawis pa rin
Yes.
bago matulog. So, visit tayo, di ba? Ang babies, dito sa Canada, sa North America, sinasabi sa atin na, hindi mo kailangan paliguan araw-araw. So, ako, with my children when they were babies, every other day, only because nakukulitan ako with everybody saying, sobrang ligo,
Yeah.
mga ngatian, especially yung panganay mo, may eczema, baka magsunod-sunod yan. Luckily, yung panganay ko lang, hindi na siya nag-manifest sa the rest of my kids. So I wanted to ask you, Doc, yung ligo ng araw-araw, does it actually dry your skin more? Tapos, yung pangalawa is, genetic ba ang eczema? Saan ba nagsisimula yan?
Yeah. So let's tackle the first question first na yung pagligo. So yung pagligo is a double-edged sword. I like to call it that way. Kasi when you take a bath or a shower, especially if you use very hot water, when you dry your skin and you don't put moisturizer, it can dry out your skin further. Lalo na pag mahaba or yung matagal kang nakasoak sa tub. So usually when we have patients with eczema, we tell them short baths or showers with lukewarm water, so not too hot. Sometimes the older kids, like teenagers, dahil ang kate-kate, gusto nila yung matagal na nakababad. And that's very bad for the skin because it's quite drying. But the important thing is, you have to moisturize after. Yun ang problema. Because if you can bathe every day, that's fine. Sometimes we even tell parents to bathe twice a day pag sobrang dry ng skin. But you have to moisturize after. Kasi if you don't moisturize, dun tayo nagkaka-problem with the dryness. Sometimes the bathing is beneficial because that's really the only way to add like water to your skin. And so, it's good to bathe, but you have to moisturize after.
Kailangan automatic talaga.
Automatic
Huwag
talaga.
makakalimutan na mag-moisturize talaga.
So I even tell like yung mga adults na may eczema to put a jar of moisturizer beside their bathroom and kitchen sink. Kasi when you wash your hands or if you do chores, automatic dapat yun.
Totoo
After
yan.
you wash your hands, you moisturize. Kasi that stripping of the moisture of the skin makes the eczema flare so much worse.
And so, isa pa, meron ako naririnig na oatmeal baths help daw. Ako, never ko nasubukan kasi wala talaga akong oras. Pero, is there some truth to that? Kasi nakikita mo sa skincare line, oatmeal.
Yeah.
Meron silang oatmeal.
Yeah.
It's like, okay, so baka naman may katotohanan to.
Yeah. I mean, there are some studies that show that oatmeal can have some anti-inflammatory properties and soothing properties to the skin, pero hindi siya kailangan. You don't need to use an oatmeal-based moisturizer or bathing. Kahit plain water lang, okay. Ang important is the moisturizing after. I will always come back to that kasi yun talaga yung pinaka-important. And it doesn't need to be a complicated moisturizer. Hindi kailangan mahal. So, more expensive doesn't necessarily mean better. Minsan, mas okay pa nga yung mas simple, mas mura. Tama na
So
yun.
ngayon, so let's say we have, well, my panganay is my prime example. Mahusay mag-moisturize, pero he's athletic, right?
Yeah.
So, sobrang active, pawisin, and makikita mo kagad. Akala mo stressed out kasi namumula na. Yung mga manifestations ng eczema namumula na. And then so, what do you do next? Of course, paliliguan mo ulit.
Yeah.
And you do apply the creams. Pero kung gano'n na mas pronounced na, yung tinatawag natin, ako mukhang galit yung eczema mo,
Yes.
di ba? Hindi lang siya, kumbaga, mas angat na sa skin.
Yes.
Ano na yung mga kailangan nating protocol when it comes to that?
Yeah, that's really when medication comes in, no? Prescription medication. That's why I was mentioning in the beginning, 50% is skincare, but 50% is medication. Kasi kahit moisturize tayo ng moisturize, if there's inflammation in the skin so that It's that inflammation that's causing that redness, nangangapal siya, minsan nagtutubig siya, tapos makate, all of that. Those are all signs na may inflammation in the skin. So, we have to get rid of that inflammation somehow. And the best way to get rid of that inflammation is medication, usually prescription medication. So they go hand in hand. Yung skincare is one part, usually, and that's like a maintenance thing, parang prevention yan. The better your skincare, the less likely you're going to have flares. Pero ang sinasabi ko sa parents, even if you do things perfectly, magpa-flare yung eczema. So a lot of parents feel very guilty pag nagpa-flare yung eczema kasi parang feeling nila kasalanan nila or may ginagawa, may ginagawa silang mali, may napakain silang mali, kasalanan ng anak nila kasi kain ng chocolate or whatever it is. Sometimes, I mean, eczema is, let's go back to your other question, kung ano ba talaga yung cause ng eczema. There is a genetic predisposition to eczema. So naka-program na siya dun sa genes nung bata. So, ibig sabihin nun, that eczema is going to manifest depending on whichever triggers. And there's really no way to fix that or to cure that kasi genetic siya. So, the goal of treatment of eczema is really control and maintenance and not cure. Mm-hmm. So, I think that's one of the frustrating things about having a child who has eczema. Kasi inisip mo, pag hindi ko siya pinakain ng chicken, mawawala yung eczema niya. Or if I don't eat seafood, mawawala yung eczema na yan. So, that's where the frustration comes in because even if you're trying to avoid all these things, nandyan pa rin yung eczema. So, parents are often like, why is this still happening? And then you're trying to like eliminate things in the diet, change the skincare. For babies, change the formula or the milk, and the eczema is still persistent. And the reason for that is there's no one cause for eczema. There's a genetic predisposition to it, and then you have certain triggers that will make it flare, but it's always, the predisposition is always there.
I think yung pag-pivot natin in all directions is kasi nakakaawa naman
Super
talaga.
nakakaawa talaga.
And yung mga friends ko na sa gabi, pati sila naiiyak na kasi de-realize nila, oh my goodness, my daughter, medyo bloody ng konti yung sheets kasi nagkakamot.
Yeah.
Eh, hindi nila alam na nangyayari to at night.
Yeah.
And then they learn and then they try to guard their daughters and sons and then sometimes nakasuot na ng medyas, naka-gloves na. So, talaga namang hindi natin mabablame yung parents for trying absolutely everything under the sun para lang ma-solve yung eczema situation. So, kung ganun kagrabe na at night halos hindi makatulog ang bata, anong kailangan gawin besides, putting on gloves and, lots of hugs and kisses?
Yeah, I mean, that's really where medical treatment comes in. And I find that a lot of kids who have eczema are undertreated that way, meaning the parents are trying to avoid using medication because they think it's harmful to use medication. But actually, what's harmful is the fact na nangangati. Buong gabi, the child is itchy all night. They're not sleeping. And so, one, the child can't rest. Their brains can't rest. That's a very important period of their life for learning, for personality development. So if you can't let your brain rest, that does something to your memory, to your learning abilities, to your concentration abilities. Especially in a school-age child, if you can't sleep at night, you can't learn well in school. So that's one. Two, it's also harmful to the parents because you're so stressed. So eczema is one of those diseases that really affects family dynamics. Sometimes when you have one child who has really bad eczema, feeling mo napapabayaan mo na yung ibang mga anak mo because you're so focused on like the skincare of that child and trying to figure out what you can eliminate from the diet and buying different groceries when really there are very effective ways of treating eczema and it doesn't have to be that way. So I always tell my patients, you want to treat eczema early and aggressively and get it under control quickly. Because the worse it is, like the deeper into the flare the children are, the harder it is to get it under control. So it's better to stay on top of it. So the minute, kunwari, if you have prescription medications already, the minute you start to see the eczema coming back, treat it right away. Don't wish for the eczema to go away because then that's the most efficient way of getting the disease under control and normalizing the life of your child.
When you have school kids or adolescents, okay lang pahit-pahit with the medication. No? Kaya lang kasi ang apprehension ng parents, pag baby at makita mo na may steroid,
Yes.
yung ipapahid mo, dalawang isip ka agad. Parang, sandali, baka kayanin ko muna na wag muna gamitin to. Why the fear? Makita mo lang yung word na steroid. Ano yung totoong fear under that?
Yeah, it's great that you've brought this up, no? Kasi steroid phobia is very prevalent. There is, as I like to call this, is like urban myth that all steroids are bad for you. And I think it's because maybe part of it is yung perception ng steroids by mouth, like systemic steroids or yung mga nagsisteroid sa gym or something like that.
That's right.
And then there's also this fear that all steroids will like thin the skin, which is not necessarily true. So steroids, madaming strength yung steroids. There's mild steroids, there's medium potency steroids, there's high potency steroids. So the important thing is to use the right potency of the steroid. And again, if you're not treating the eczema properly, like super konting nilalagay mo na steroid, you tend to have to use it longer than if you just treat the eczema properly with the right amount of steroid and the right strength of steroid. And then you might not need the steroid for a long period of time. So that's one. Second, we also have medications that are non-steroids. And I like to say these are all part of our toolbox. So one is not better than the other, like non-steroids are not necessarily better than steroids or the other way around. But it's nice to have a combination of medications that we can use to keep the eczema, one, to get the eczema under control, and two, to keep the eczema under control. So madami na tayong advancements in medications, not just for creams, but also now we have advanced systemic medications. I'm going to call them, some of them are pills, some of them are injectable medications for kids who have really bad eczema, where once you've optimized your topical use, yung medications mo topically, and talagang masama pa rin yung eczema, then that's the time to move on to the next step, diba? Because I think letting the eczema just kind of keep going on and hoping that, changing their diet or a better moisturizer will make it go away, I think delays treatment. And having uncontrolled eczema, I think, has worse side effects in the future than using a steroid for a few weeks.
At syempre, you have to realize, doktor mo mismo nagbigay na kung gaano karami, gaano kadala, so hindi ka nanguhula. Yun yung dapat na peace of mind na ituro natin. Kasi sabihin, ay naku, steroid, natakot ka na. Nakalimutan mo na na talagang mahaba yung proseso bago nag-reach dun sa conclusion na, okay, ito yung kailangan niya at this point in time. Malay nga natin, after nito, wala na. Or malay natin, after nito, ibang kailangan na approach. So, yung mga parents na they're trying different approaches, like you said, changing a diet, bakit nga parang pare-pareho yung ginagawa natin na either, hindi ko alam kung it's because of Eastern traditional treatments, ang traditional medicine na sinasabi nila, okay, yun nga, huwag ka kumain ng mga seafoods. Ano pa ba? Hindi ko pa narinig yung tsokolate, pero sa akin kasi, chicken. Kasi ang sa akin, ang tsokolate, may you break out parang acne and all that, diba?
That's another misconception,
So, kapag eczema, pinaka-malakas talaga na naririnig ko is yung seafood. Yung chicken, medyo bago. Kawawa naman kung totoo yung chicken.
Oo nga, diba? Ang lungkot naman.
Ang lungkot naman nun.
Paano na si Jollibee?
Kaya nga, wala tayong pag-asa. So bakit natin, una, pinaniniwalaan?
Yeah.
Like, kasi syempre, it's one thing to hear about it once, but then a lot of people say it, and they go, oh yeah, when I took seafood out of my diet, hindi na nag-flare up masyado. So syempre, isang sabi lang ng ganun, maniniwala ka talaga kagad, and you're gonna try it yourself. So, substantiated by mga ganito na mga recommendations na you can actually heal it by changing your diet.
So I think it stems from the fact that people who have eczema will more commonly have food allergies.
Oh, okay.
So they coexist commonly in the same patient. And that's true for eczema, food allergies, yung allergic rhinitis, yung seasonal allergies, asthma. They're all sort of part of the same family of diseases. So
Kasi natitrigger.
Yeah, and I like to call them their cousins, but they're not the same disease. So if you have a food allergy, obviously the treatment for a food allergy is to avoid the food. But the problem is eczema is not a true allergy, right? It's not a one allergen type of situation. So, yung ibang tao, parang they just confuse all of that as being one disease, where if you remove the trigger or you remove the allergen, you can treat all of that. But that's not true, even though they're cousin diseases. But there is a strong association, especially for people who have worse eczema. Now, the more recent studies actually show that in babies, if you don't keep the eczema under control, especially on the face quickly, that can be a point of sensitization for food allergies in the future. So that's even another reason to make sure that the eczema is under control. Because if you have intact skin, then foods, like let's say, syempre yung baby pag kumakain, kalat-kalat yung then those foods have no opportunity to sensitize kasi the skin barrier is intact. So that's one of the things that are coming out in some studies now, that maybe treating eczema early can prevent some of these like cousin diseases.
Okay, so yun yung pagkain. Let's talk about kung ano-ano naman ang pinapahid. So I'm hearing, halimbawa, narinig tayo ng phone natin, no? So mamaya yung mga recommendations on Facebook, lalabas-labas na. So marami ako nakikita from like creams na hindi ko alam, hindi ko kayang basahin, to honey-based creams, or hindi ko na alam kung anong tawag doon. And you know, ang dami mga nagre-review, and of course, we have to be a little bit more skeptical about it. Pero ano na rin to na why would we opt for something like that? Let's say yung honey.
Yeah.
Hindi ko alam kung ano pang mga ibang ingredients na sinasabi nila na oatmeal honey. I don't know what else. Tea tree, ganyan.
Green tea. Like, there's a lot. I mean, you will find like one study here, a report here, but very, very small, and usually when they do the bigger clinical studies, it doesn't pan out to be anything. I think a lot of this comes out of the frustration and the desperation to treat the disease without medication. So people will try to find non-prescription ways to treat the disease. And that's true for any disease. So I will tell the parents na if you Google treatment of eczema and you see 300 suggestions of natural things that you can do, none of them probably work. Because if one of them worked consistently,
tapos ang kaso.
Yes, we would all, right, suggest that. So like for instance, I often will use, let's say, diabetes as a parallel. You know, there are some people who have mild diabetes, and if they fix their diet and their exercise, their blood sugars will go down. So I liken that to some people who have eczema, where, you know, just good skincare is enough to kind of keep the eczema under control. But there are people who have diabetes, and no matter what they do, they'll need pills, diba? May metformin or other diabetes pills. So even if they're trying to change their lifestyle, the disease is bad enough that they'll need prescription medications. And then there are some people, even though they've changed their lifestyle, they're taking their pills, mataas pa rin yung blood sugar nila, and they'll need insulin. So pareho yan ang eczema. There are some people who have mild eczema, where, you know, a little bit of moisturizer and, you know, just making sure you do good skincare is enough. There are some people where that plus a little bit of prescription cream is enough. And then there are some kids that even if you do all of that, they just have bad eczema. So, kunwari yung diabetes, we're not gonna say, sorry na lang, masama yung diabetes, wag natin gamutin. It's the same thing with eczema. Or like if you have a child who has bad asthma, you're not gonna say, oh, I know dust is a trigger, so maybe I just won't expose my child to dust, but let's not treat the asthma. Parang we never say that about other diseases, but for skin diseases, I think people think, sa balat lang naman yan, we can risk it, na wag muna natin siyang gamutin, not realizing the impact of that skin disease on the child when it's been going on for so long and when it's been very bad and very itchy and the child is suffering. Diba? If you can imagine, I know as a parent, we want like to keep our children safe, right? Like we want the best for our children, we want to keep our children safe. And so that's sometimes where the hesitation to medicate, to apply medications comes from. But also not treating the eczema is also not the safest thing to do because untreated eczema has side effects long term. Yun nga, we talked about concentration, personality, memory, and you know, the fact that the baby is crying all night means that they're suffering, and we can't leave them suffering.
Ito namang tanong ko is more cosmetic. Kasi syempre, they're gonna grow up and then they realize, this stupid thing is bothering me with my homework. But then when they, let's say, nag-heal momentarily eczema, napapansin ko, nagkakaroon ng discoloration na parang, lalo na kung athletic nga yung anak mo, and you're always like tanning.
Yeah.
Pero kapag humupa na yung eczema, parang new skin ang itsura. Right? So may konting discoloration.
Yes.
Is there a way to treat that? Hayaan lang? Anong kailangan gawin?
Yeah, usually that will go away on its own. Pero that's another reason to treat eczema early. Kasi the more aggressively you treat eczema earlier on, the less likely the discoloration is going to happen. And that's especially true for, lalo na pag lumalaki na yung bata, nagiging mas conscious na sila. So, you know, yung quality of life effect ng eczema, so in babies is the sleep, the itch, in a school-age child is like concentration in school and, you know, again, sleep. Habang tumatanda yung bata, like for teenagers, it really does affect their self-esteem. I have patients who've been bullied in school because of their eczema. They can't dress the way they want to dress. They can't play sports. Alam mo yun, they can't participate. I had one kid before na sobrang bad ng eczema niya. Like he couldn't go to any of the field trips in school. So, especially in that age group, there's a very, very big effect of eczema on their psychological well-being. And we need to take that in consideration also when we're trying to discuss pros and cons of treatment. Diba? Kasi yun nga, sometimes the parents are like, ay, ayoko mag-steroid cream ka, wag ka magsa-steroid cream. But all of these things are happening. You know, the child is not swimming or playing basketball, or in the summer, they're always wearing sweats, even in the middle of summer, because they're trying to hide their skin. So that has effects on the teenager long term. They're dating, you know, those are all important things. I tell my parents, it's hard enough to be a teenager, but to be a teenager with eczema or some other skin disease is double the effort and double the burden on the child.
So let's debunk another myth. Nakakahawa ba ang eczema?
Yan ang hindi. Which is nice.
Which is nice.
Yeah, which is nice. I think within the family, I think people know that, but other kids don't know that.
Exactly. Because
Right?
there's a reason why they're hiding themselves.
Yes.
If they learn that it's a condition. Lumalabas, nawawala, 'di ba? Parang mood. Pero it's not going to harm anybody.
It's true, yes. And that's important to kind of educate everyone. But I think the effect of having something showing on your skin is not just about, I think, the child feeling na nakakahawa to or their friends thinking that it's contagious, because it's all about self-perception as well. And that's true for even like pimples, right? Like acne. That's why the effect of acne on a teenager is very, very big, because it affects self-perception and self-esteem. And so eczema, just the fact that it's itchy is bad enough, but people can also see it. I have patients who say, you know, when you have skin disease, it's like it's a disease that you wear. You cannot hide it from anyone. And so how the world perceives you is changed by the fact that you have a disease that other people can see. And then the way you react to the world changes because you feel like the world perceives you differently. So I think that's part of it. Like your self-image is affected when you have something that is perceptible to the outside world.
So do you actually advise your patients how to perceive their skin condition and how to go about it? Of course, ikaw, medically, you treat them. Pero do you actually talk to them as well and say, you know what, this is not something you can easily get rid of. We can treat it. It'll go away. It'll come back. But be okay with it.
Yeah. You know, that always comes into the conversation, especially when it comes to like teenagers. But having done this for many, many years, I've been in practice almost 20 years now. I think the most important thing is to treat the eczema well, because I see the change in the personality of the child before and after treatment. You know, I have kids now who are now married, they have children now, they're like nurses, firefighters, policemen, and I can, you know, we talk, they still see me because it's been 20 years. And we talk about how much their lives have been affected by the disease and how it's changed because now we've kept their disease under control.
Is eczema more prevalent in Asian skin or tayo lang ang nagkukulitan? Kasi if our solutions na naririnig natin are, you know, Chinese traditional medicine based sometimes, kung hindi medical, but what about other cultures?
There are some studies that seem to suggest that eczema is more common or worse in Asian skin, and Asian patients are itchier than you know, patients from other cultures or other races. I have a colleague who's also Asian who says, we're just itchy people.
Kaya mahilig tayong maligo.
So I think it is common. I definitely think it's common, and you know, people always say, and I just got this when I moved to Canada. When I was practicing in the Philippines before I moved here, and I would see it there too. So it's not just because you moved to Canada and it's dry and, you know, there's something about the water here in Canada that made your eczema flare, because it's prevalent everywhere.
Okay. And then, so kapag, let's say, tumanda na, no? So as grown-ups, meron bang pagbabago doon sa treatment? Are there stronger stuff na hindi pwedeng ibigay sa younger children? Ano nang lagay? Kasi syempre, when we're grown-ups, parang ang dami rin natin options for like supplements.
Yes.
Kung anong vitamins for him, for her, diba? So,
Yeah.
how does the you know, eczema treatment come into play dun sa ang dami-dami nating myriad of things that we can take?
Yeah. So I'm going to address two things here. One is this misconception that everyone outgrows their eczema. You'll hear that, hayaan mo na yan. Mawawala din naman yan eventually. Which might be true, but not always. The worse the eczema, the less likelihood that the child is going to outgrow it. If the child has, you know, asthma, seasonal allergies, food allergies, there's also less likelihood that they're going to outgrow their eczema. And if there's a strong family history, that's another kind of poor prognostic indicator of the child being able to outgrow their eczema. So not everyone outgrows their eczema, and that's very, very important because some people will carry it into adulthood. I also have patients who had eczema as a child, and then they were good for a few years, and then in their 20s, their eczema will flare. That's another very, very common story. So the treatment principles are sort of the same. You know, skincare is there, but again, making sure that you're using the right medication that matches the severity of the disease. One of the analogies I'll use is you can't use a garden hose to put out a forest fire. So it really depends on how severe the eczema is, and we always want to treat appropriately and not undertreat patients. And so in adulthood, we do have more options in terms of, like, you can use stronger steroids in adults versus children where you might not want to use like very potent steroids. There's also more systemic medications that are available for adults. And not because they're dangerous for children, it's just that they haven't been studied in children, some of them. But the nice thing is a lot of the clinical trials for eczema automatically will now include teenagers, like kids 12 and up, recognizing that it's a very important disease in the younger patient population. So a lot of the medications we can use in adults, we can often use in teenagers. It's really, you know, the babies and the school-age children that are sometimes the second layer of clinical trials or studies, because obviously you want to keep them safer. You're a little bit more conservative with children, and that's totally understandable. So yes, we do have a few more advanced options in older patients.
Pero may naririnig ka na ba na medyo genetics na yung try nilang isolve? Kasi you were saying, it's something na hindi natin kasalanan, actions-wise, pero if it runs in our family, more likely, makukuha natin. I remember when my oldest got diagnosed with the eczema, ang unang tanong sa akin, I forgot who asked me, was, sino sa inyo may asthma?
Yeah.
Yun yung unang tanong
Yeah.
pa eh. Ako sabi ko, wala. And my husband was like, guilty. So he felt bad right away,
Yeah.
right? So in terms of advancements, may naririnig ka ba na someone's trying to like look into the...
It's hard to fix genetics, right? It's very hard to
Pwede
fix genetics.
tayong iba-pluck out and...
I know. Not yet.
Not yet, uh-uh.
Maybe in our lifetime, who knows? So that's what I'll tell patients. You know, some of the people will also say, some of the patients also say, well, if it's genetic, then we're just like masking the symptoms.
Exactly.
Diba? Parang we're not really curing it. But that's true for many diseases. We don't know why many diseases come up, but that doesn't necessarily mean we don't treat it. Right? Like, we don't really know why people get diabetes and people don't. But that doesn't mean we don't treat the diabetes. It's the same thing with eczema. Yes, we cannot cure it, but that doesn't mean we can't treat it.
So if it is cousins with, allergies, right? But is it also a gateway to more complicated skin conditions? O wala naman siyang connection?
There are complications of eczema on the skin, like infections are very common in patients who have eczema, especially when the eczema is not under good control. So bacterial infections, viral infections, those often will bring children to the hospital, like to the emergency room, because they had like a bacterial infection or a viral infection on top of their eczema because the skin barrier is broken, it's not healthy. And if the skin is open, that serves as an entry point for bacteria and viruses. So that is a very important complication of eczema as well.
So basically, pag hindi natin inagapan nga, yun ang mas malaking umpisa
Yes.
ng problema.
Yes.
And so yung ating pagka-guarded, because we want things to be natural, right? Parang meron tayong programming na mas may peace of mind tayo when we're not touching anything.
Yeah.
And it's true for a lot of things, but not everything.
For
right?
sure.
Pag hindi natin inagapan, tuloy-tuloy na, may domino effect, and then in the end, emergency na naman ang takbo natin.
Yeah.
So that's what we're trying to prevent.
Yeah. At saka kawawa yung bata.
At kawawa talaga yung bata.
At the end of the day, if we're delaying treatment because we're hoping we're going to find a permanent solution to the problem, we are delaying care. And we're delaying improvement, and we're delaying relief from the itch, the skin pain, the sleeplessness, the suffering. We're delaying care. Yeah.
If you find yourself either at school or at work na bigla na lang nag-flare up, right? So, anong pinakaunang first response mo dapat? Should you have like a jar of petroleum jelly somewhere?
Yeah.
Or
Sometimes when I have kids who are very severe, they will bring moisturizers to their schools. There are some tips and tricks, like if it's very, very itchy and you want to relieve the itch very quickly, you can put some moisturizer in the fridge, and then you can apply it on the skin, and that cooling effect of the cold moisturizer sometimes will give the children like very quick relief. Again, of course, that's temporary kasi, the temperature will change and then it'll become like skin temperature. But that's a very nice sensation. Instead of using like, I have eczema. When I was a kid, I remember putting like alcohol on my skin because it was so
kasi
itchy.
malamig.
Yeah, it was so itchy that I would rather have pain instead of itch. So I would like put alcohol here, and then I would like do this all the time. But that's how intense itch is, diba? Like if you can imagine, if you have like mosquito bites na makate, parang hindi ka
You gotta
mapakali.
scratch it.
Diba?
Exactly.
Hindi ka mapakali. So that's how the child feels. They just can't express that because they don't have the words yet to express that. But that's what they're feeling all day, every day. It's not a fun disease to have.
If your instinct was to get the alcohol, kasi access natin sa rubbing alcohol, grabe,
Yes.
diba?
Yeah.
As Filipinos. So tama ba na yung cold compress nakakatulong?
Pwedeng cold compress, that's okay. The problem with the cold compress, because it's water-based usually, you do have to moisturize after. Yeah, kasi you're still soaking the skin, diba? So just be careful about the cold compress. And make sure you're moisturizing the skin after. That's why I like the strategy of moisturizer in the fridge, because then it's like double purpose. You're already moisturizing the skin, and at the same time, it tends to stay colder longer because it's like a thicker thing than just water.
And for our dalagitas na hindi pa nawawala, let's say, flare-ups, what about makeup?
Yeah.
We have to ask it kasi
Yeah.
syempre, people are going to dances, people are going to
Yes.
proms, people are going to church, gusto magbihis, gusto magpaganda. So, paano na kung meron ka eczema?
Pwede naman. And that's really, I think, if you keep the eczema under control, if you're on a good maintenance kind of recipe for your eczema, you can wear makeup. It shouldn't be an issue. And if the eczema is bad enough that you cannot wear makeup at all, then we're under-treating the disease. Of course, you want to choose makeup that's, like not very fragranced and something that's not too drying on the skin. So there are some makeups that are, let's say, mineral-based that might be more drying. So you can choose more cream-based things or use kind of a moisturizer underneath the makeup before you put on your foundation, or use a tinted moisturizer. Because a lot of makeups that are targeted towards teenagers are usually like mattifying makeup or for acne-prone skin. And those will often have drying agents like zinc, or they might have ingredients like salicylic acid that address more the acne part of being a teenager. That might not be the best choice for teenagers who have eczema.
So, it's safe to say na as long as you have good communication with your doctor.
Yes.
Diba? You tell your friends, be open about it. It's okay to talk about it. Huwag ka
Yeah.
mahiya.
Yes.
You have to really be close to your parents and communicate. The mom, it's itching. We need to do something about
Yes.
it. Don't hide in your bedroom. Don't just cry by yourself. If you need to see the doctor, you need to see the doctor. At rest in the thought na case-to-case basis.
Yeah.
So, kung ano man yung treatment na i-recommend sa inyo, it is personalized to you. I wanted to thank Dr. Perla Lansang, mahusay sa galing ng kailangan nating gawin sa ating balat. And today, we were talking about eczema on Insights. Sabihan nyo lang kami if you want to have her back. We plan on doing many, many more things like this because we really think the community can benefit from it. And thank you so much, Dr. Perla Lansang. And that's it for today's Insights. We will see you next time.